Hi, this is Gary McLeod with a COVID update. Today I thought I would dictate it for you, make it easier for you, but I've also sent it to your Outlook so you can reference it later. First thing is our respiratory clinic. Just to let you know, it's up and running very smoothly. We have 4 providers working there from 9 to 5. They're seeing about 60 patients a day, and at this point about 2/3 of those patients are actually being tested for the COVID virus. We've had a sufficient increase in calls on the weekends for respiratory issues, so we do plan on getting that clinic up and running starting on weekends, trying to get up and running for this weekend. I think it is important for you to know that we still are testing patients based on CDC criteria, and I have an attachment on my Outlook message that delineates that. So that's important for you to know. When patients come, please do not guarantee them that they will be tested. Next thing is about the ambulatory treatment of COVID. You probably have seen a lot on the news from our president, on the media, about some of the treatments that are popping up for COVID, such as chloroquine. In talking with our ID specialist, Gary Green, he says this is way too premature to be using these treatments. Several downsides of using the treatment are that they do have side effects. We could exhaust the nation's supply of these medicines. And in one of the most serious ones is if one does get very seriously ill, Gary points out that the use of these medicines as an outpatient could preclude someone from using the experimental drugs in the ICU. So there are several studies ongoing, and we just need to continue to practice evidence-based medicine and not prescribe these drugs. We are accepting donations of all PPE, particularly masks and gowns from the general public. We'll take anything that's unused and unopened. You can bring those to the airway building. They can be left with the security guard, or if you want to take the trip up, Aaron Neal is the one who's coordinating our collections. Next is a major change began today in our offices, as you're aware, that we are now using surgical masks for all providers and MAs who are in our patient treatment areas. One mask will be given to you for the entire day. This is called extended use. Clearly this is to protect you from a patient that might be sick, but what's more interesting, and the rationale for applying this now, is that several studies have found that at this point in the pandemic, it is the healthcare workers who can become a source of infection for their patients. So this works both ways. We're trying to protect us and we're trying to protect our patients. And just to give you a heads up, the daily temperature checks for all of us when we enter our offices will be coming soon. Next is virtual visits. We're working very hard to roll out video visits. It appears that the standard format that we're adopting and going forward will be using iPads with Canto software, which somehow communicates with Epic. So this is being rolled out in waves. You'll be informed when you're up for that. It will require that you have an iPad. So you can bring in your own. You can purchase a new iPad, and if you're not willing to do either of those, I should say if you purchase an iPad, that can be reimbursed, that money can be reimbursed through your CME funds. And lastly, if you don't want to do either of those, you can request from the foundation to get an iPad, but supplies are going to be limited. If you want to pursue that, you should just reach out to Peter Valenzuela, who can try to secure you one for you. Specifics about virtual visits, there's a lot of emails out there, a lot of information. I would just wait to hear about specifics from our Epic team and Jennifer Williams. And then finally, I just want to point out, we are all considered the informal leaders of our clinics. And I think you need to realize that your staff really look up to us for guidance and direction. So last thing I want to say is please do go out of your way to thank your staff, to uplift them, and make them feel like they're a strong part of our team. Thanks.